me introduce our host, Dr. Jennifer Shu. Dr. Shu is a practicing pediatrician, author, and mom in Atlanta. She's a frequent guest on national and local TV, radio, and web-based programs, and co-author of the AAP books, Heading Home with Your Newborn and Food Fights. She's also the medical editor of healthychildren.org, the official parenting website of the AAP. Welcome, Dr. Shu.
Thank you so much for having us today and hosting this talk on food allergies. So for anyone who has children or cares for children, awareness of food allergies can sometimes feel overwhelming. And understanding food allergies, from recognizing the early signs to knowing exactly what to do in an emergency, can transform anxiety into confidence and help you create a safe, nurturing environment where your child can thrive. Joining us to talk about this today is Dr. Daniel DiGiacomo. Dr. DiGiacomo is a pediatric allergist and immunologist at K. Hovnanian Children's Hospital at Jersey Shore University Medical Center. He completed his pediatrics residency at Children's National Medical Center and fellowship training at Massachusetts General Hospital in Boston. Dr. DiGiacomo has a clinical interest in infant food allergy. He enjoys spending time at the beach with his family during his time off and is an avid New York sports fan. Welcome, Dr. DiGiacomo.
Thanks for having me.
So let's go ahead and get started with just some basics about food allergies before we answer our audience questions. First of all, can you tell us what some of the common causes are of food allergies?
Sure, of course. So allergic reactions to foods generally are caused by harmless proteins found in some foods. They're most common in babies and children, so around, infants or up to age 1 or 2. Yeah, but they can happen at any age. They occur more often if your child has other allergies like eczema and or egg allergy, or if there's a family member with allergies. Any food can cause an allergy, but most are caused by foods like cow's milk, egg, peanuts, tree nuts. These include things like walnuts, pistachios, pecans, and cashews, sesame, soy, wheat, fin fish like cod or salmon, and crustacean shellfish like shrimp or lobster. Peanuts, nuts, milk, and sesame are some of the most common causes of severe reactions as well.
Okay, good to know. So being aware of these foods can make parents and caregivers a little bit anxious about introducing them to their babies and young children. So what should they do to do this safely?
Yeah, sure. So the latest research shows that once your baby is ready to start solid foods, it's around 6 months of age, this is a good time to introduce foods that are more likely to cause allergy. There's really no benefit in delaying. And we generally start first with low-risk foods. So if your pediatrician says you're ready, and developmentally we're ready as well and look interested. And these foods include things like infant cereals, pureed bananas, or prunes. And it's really about starting off small and nice and slow, and then waiting a day or two before introducing another food, as long as nothing else is happening that is concerning for a reaction, like rash or diarrhea or vomiting. And if you do notice a reaction, stop and call your pediatrician.
Okay, great. So once your baby does tolerate one of the non-allergenic foods you mentioned, like fruit or cereal, how do you then introduce allergenic foods, like, for example, peanuts?
Great question. All right. So again, the overall arching goal is to continue to introduce these foods, right? In small amounts, a couple days in between. But let's look a little bit more specifically at peanut, for example. So we used to think the best way to avoid peanut allergy was to just avoid peanut products in the first years of life. But there was this amazing study, this major study in 2015 that found that introducing peanut products to infants prevented peanut allergy. Recently, there are a couple follow-up studies that looked at kids around, age 5 and then again around age 12 that found that early introduction, regardless of how you continue to eat peanuts later on, still has a lasting effect as they get older in preventing peanut allergy. So ideally, peanut-containing products should be introduced to babies who are at higher risk of developing a peanut allergy as early as 4 months, but usually around 6 months. And these studies have found that this process, this practice can reduce the development of peanut allergy by up to 86%. And then another reminder, which we'll mention a couple of times, is that if things are going well with food introduction, it's always important to keep the new food into the diet at least once a week, ideally a little bit more.
Okay, so keep everything in the rotation, and we will come back and talk about that high risk group a little bit later. But for now, if parents, we know we're not supposed to give whole peanuts because they're a choking hazard. So how would you introduce the protein to a baby?
Yeah, right. So never give a baby whole bits of peanuts, like we said. Introducing it in a creamy peanut butter that's thinned out with breast milk or formula is a good way to go. You can also mix peanut butter in a puree or try a snack like a peanut butter puff, like something like Bamba. Generally, though, it's just you want to make sure the consistency is appropriate for their age.
Okay, and so you had mentioned previously about high risk babies and treating them a little bit differently. Can you talk a little bit about that?
Mhm. Yeah, for the high risk babies, so these are generally regarded as those with severe eczema or another food allergy. We recommend talking with the pediatrician first. So, peanut allergy testing prior to introduction here may be done, but it's not always recommended for everyone. Another option is to do a first taste in a doctor's office. For those with mild to moderate eczema, so not that as high risk, testing isn't needed, but usually we recommend checking with your doctor about introducing some of these age appropriate consistencies of the peanut butter. And for babies with no eczema or food allergy, they can try these foods anytime around 6 months of age. And just remember, once a food is introduced, it's important to keep it in the diet.
Okay. So what kind of symptoms might you expect to see if a child does have a food allergy?
Okay. So just to kind of rehash, like an allergic reaction essentially is when the body's immune system is overreacting to like some of these foods like we talked about, like peanuts, eggs, or seafood. And everybody's different. But generally and reactions can be anywhere from mild to severe. And this includes going through the different systems, skin problems. So like red, raised, itchy hives, any other itchy skin rashes or swelling anywhere around the face or anywhere else in the body. You can have breathing problems like sneezing, wheezing, increased nasal congestion or throat tightness, or stomach issues like nausea, vomiting, or diarrhea, loose stools, or circulation symptoms, which can include pale skin, lightheadedness, or a loss of consciousness.
Okay. Are there any other symptoms that you might see?
Yeah, so it's an important to recognize a couple things. Right, we introduce foods in babies, and the most common onset of food allergy, right, is in younger children. There are some particular symptoms that babies can have that are manifestations of allergic reactions that we should, be cognizant of. This includes eye rubbing, repetitively sticking your tongue out, just excessive fussiness or crying that seems a little atypical for the child, arching of the back or even bringing up the knees to the chest, just looking really uncomfortable, or decreased muscle tone.
Okay, thank you for that. And so if a parent or caregiver does suspect the child has a food allergy, how would it ultimately get diagnosed?
Okay. So, sometimes a food allergy is obvious, like you get hives or lip swelling we discussed, but sometimes the symptoms are less obvious. If you do, though, suspect your infant or child may have a food allergy or you have a family history, first talk with your pediatrician. They may suggest some skin prick testing or blood test and refer you to an allergist. So, for the skin test, um, to describe this test, this is where the doctor pricks the skin with a small drop of an allergen on the back of the forearm. Then, after about 20 minutes, you measure the amount of redness, swelling, and itching at that specific site. Then, regarding the blood test, this is a blood test that's sent to the lab and measures the specific antibodies to these foods. If these tests are positive, it's actually not enough to diagnose food allergy. Your pediatrician will talk to you about reactions you've seen with your child to these certain foods as well, and then help to decide the next steps in making a plan.
Okay, so it's a total picture thing, not just one single test. So what about a severe allergic reaction? If something is, pretty strong, what would a parent need to do to treat that?
Yes, of course. So when a reaction is severe, this indicates that several systems of the body are affected. So usually it's a multiple of those different areas that we discussed just before on for allergy symptoms. And when this happens, this is called anaphylaxis, and it requires immediate medical attention. So it's important to not understate that the definitive, the main treatment for anaphylaxis and severe allergic reactions is epinephrine. Okay. And this comes in an automatic syringe, which is by prescription, that gives you the medication when you push it into the thigh. It also recently has been approved as a nasal spray for kids who are 4 years and up and weigh at least 33 pounds. Okay. So if you do recognize that anaphylaxis is occurring, you should give epinephrine as soon as possible, then call 911, which will then be followed by a trip to the emergency room. During a reaction, sometimes you can give an oral antihistamine. This is something like Zyrtec or cetirizine or Claritin and loratadine or Benadryl or diphenhydramine, but this should not be used in the place of epinephrine for a severe allergic reaction or anaphylaxis. If your child is at risk for anaphylaxis, it might be helpful to have your child wear medical identification jewelry that includes information about your child's allergy. If this decision is made and a bracelet is worn, the wording should be reviewed by a healthcare professional and it should be worn at all times.
Okay, good to know. So, what are some ways to prevent allergic reactions from happening?
Mhm. So, first and foremost, avoid the food, right? So this involves understanding where, like what the food is and where it is included in different food products and knowing the importance of things like label reading as well. There are some other options that have recently become available or more popular. This includes a medication called omalizumab or Zolair. It can stop an allergic reaction to food from becoming severe if a child is exposed to that food. There's also a treatment called oral immunotherapy that can help desensitize your child's immune system and involves introducing a very small amount of the food and slowly increasing the amount. These treatments are prescribed by an allergist immunologist, and they don't cure food allergy. Your child will still need to avoid the food that causes their allergy.
Okay, so it just makes it less severe if they do
Mhm.
have an exposure and a reaction. Is that what you're saying?
Yeah, generally, it's these are forms of like desensitization or kind of threshold raising kind of interventions that will hopefully, if there's an exposure, lessen the severity of a reaction.
Excellent. So this information has been extremely helpful. And now we're going to turn to the questions that were submitted beforehand, as well as people submitted during the chat, in the chat box during this session. So we've gone through and looked at some common themes that people are asking about. So the first question is it important to keep waiting a day or two in between new foods? And if so, how long do people need to do this?
That's a great question. So there's a couple different approaches or ways to think about it. I think for new non-allergenic foods, I think traditionally we've been counseling to wait several days. There's not actually a lot of good information on that. Um, So I think that if there's been a couple introductions of the food and if everything's going well, you can move on to the next food. If you're dealing with a more allergenic food, that's a little bit different story. So we talked about slowly introducing the foods. So in that case, I usually will take a couple more days to slowly increase till you get to kind of that age appropriate serving size.
So let's say if you're finally introducing a new food at age 2, do you have to still wait? Like let's say you never got
Yeah,
around to introducing egg, for example.
yeah.
Do they still need to be cautious at that age or
Yeah, that's a great
afterwards?
question. Yeah. All these recommendations are usually what it's like first time introduction, stuff like that. But what like when they're a baby. So I generally say it's if you want, you can start off with just a small amount if they're older and they haven't tried something like a spoonful or a tip spoonful, and then you can wait like for an hour or so. And if nothing happens, you can gradually continue to introduce the food as they get if they're a little bit older. So.
You've mostly talked about kind of introducing foods one at a time. How do you feel about people who just kind of do multiple foods and hope nothing happens? And then, okay, so yes, they tolerate 3, or if they do some of those powders that you mix into your food that
Mhm.
have multiple different ingredients just to, introduce.
Mhm.
Process of elimination might be harder if you do all at once, but is that dangerous?
So it I would think about it again in a couple of different ways. As a first, like those powders, right, of these highly allergenic foods, they can be really tough because not all of these companies are very clear about how much food protein is in these, and it's often a mixture of them. And it can lead to very difficult kind of diagnostic measures and would lead to avoidance of multiple foods and then having to go to the allergist and get, more skin testing and potentially do something called a challenge where you come in and determine truly what was the culprit, and it can just add a lot. So that's why we like to be systematic. On the other hand, though, I my personal approach is I don't want to cause I don't want to over medicalize food. And if there's a food that you want, if you want to try two foods together, I personally am like, and you're just like, you think the kid will really like it and you're very excited about it. I don't get too pushy. So.
Okay. And always, if there's any questions, talk to your pediatrician since they and your child the best. What about introducing allergenic foods in a certain order? Is it important to do eggs before peanuts or peanuts before shellfish?
So again, my common practice has been to first ask what's important in the home environment. What foods do you guys eat the most? Right. So there's this hypothesis that's out there. It's called the dual exposure hypothesis. So it says that foods that are in your environment that you aren't ingesting yet, you still might be exposed to. And if you're not exposed to them in the typical tolerance means that you're eating them. So instead you're like kind of like on your skin or you're changing your child's diaper, then these might be foods that are actually higher risk for developing an allergy. So earlier, putting those foods first is more advantageous or more recommended. So I usually say, think about the top food allergens, and then you should think about what you kind of eat at home most commonly and kind of start with those.
That's good advice. Okay, so the next question is about maybe the genetics of food allergies. Do they run in families? So if a parent has a peanut allergy, for example, is a child going to also have a peanut allergy, or would they possibly just be allergic to a different food? How does that work?
Mhm. Mhm. Yeah, so that's another great question. It's not exactly clear, I think, the magnitude of the risk of family history. It used to be believed that it was a lot higher than I think it currently is now. There was a pyramid developed of like risks developed by the allergists a couple of years ago that deemed that the highest risk factors for food allergy actually are severe eczema or having another food allergy. That family history, while it is a risk factor, is likely lower on the scale. So it's most likely that you know, if you have a food allergy, you might have had eczema when you were younger, and that might have been the main driving factor. And it doesn't necessarily mean that it's food specific. It might just mean that you are at increased risk generally for food allergies. So early introduction is important in those situations.
Okay, good to know. So not the exact food type allergy.
Mhm.
Okay. The next question has to do with the timing of the appearance of a food allergy. So let's say I give my baby scrambled egg for the first time and he's fine after 2 hours. Is it safe to assume that he's out of the woods, or what's that timing expected to be?
Of course. So most food reactions, first, they mostly involve the skin, so like hives or itchy rash, and they involve areas beyond the direct site of contact, so like not usually on the mouth. And they usually appear within a couple minutes to an hour, occasionally 2 hours. So if you've gave the food and an hour has gone by and there's no reaction, it's very unlikely. There are other types of food reactions you can find too. So if you notice that your baby is, for example, vomiting a lot and it's several hours later, I just say talk to the pediatrician and ask for more clarity beyond.
Okay. So one thing you mentioned is that you can develop a food allergy at any age of life. So even an adult can. So why is that? Especially if they've already been exposed to something. So I hear this from friends, they have a shrimp allergy, but they didn't get it till they were 35. What's
Mhm.
happening here?
It's another great question. I don't know if it's been fully elucidated yet, but we do know a couple things. One, that it does happen. You can't have sudden onset new food allergy of something you've been eating totally fine. Generally, there's a period where you haven't been eating for a while, and there are more common foods. So these foods include shellfish, tree nuts, and peanut are the kind of foods that may occur. And it's not exactly known, but there might be something in the environment or some interaction with the medication you are taking or some other hormonal change. It's not very clear, but there are likely risk factors that will be further uncovered. There is one other kind of adult onset food allergy too that is a little less classic is something called oral allergy syndrome, which is common as you get older. It has to do with having like seasonal allergy symptoms and mouth tingling, and that's usually a little different than like the kind of the systemic food allergy we were describing.
Okay, so there's always a chance, unfortunately. And the next question is, should I get a prescription for an epinephrine injector before starting my baby on solid foods?
So getting a prescription for an epinephrine emergency medication is not needed prior to the introduction of the food. Studies have looked at this, and the risk of having a severe allergic reaction with the first time introduction of food is very low. So we usually just say we recommend early introduction, food friendly, food forward. And if you're worried, you can do it, you can ask your pediatrician if you can come by and introduce it there.
Okay, yeah, and just know that sometimes the medicine can be expensive, may not always be fully covered by insurance, and it does expire after a certain time. So, all things to consider, but maybe if your child is high risk, you might want to talk to your pediatrician about that. You mentioned the various different oral antihistamines, such as cetirizine, which is Zyrtec, and loratadine, which is Claritin. What do you think about trying to give an oral medication first before epinephrine if a parent suspects a severe reaction?
So for a mild reaction that involves a very localized area of the skin, an antihistamine may be appropriate, but I don't recommend using that and anticipating that that will cure a more severe reaction from going on. So I always just urge caution that if you think your child is having a severe allergic reaction or anaphylaxis, that you used epinephrine.
Yeah, and I do think some parents are a little bit, maybe timid about using an injection
Mhm.
on their child. I mean, I'm timid about giving my kids vaccine shots, for example, because I just don't like to see them in pain. But so it can save lives, basically, is what you're saying. And it's important to give. One thing I like to remind parents is that when you do the auto injector, you don't want to put your thumb over top because if it's upside down, you're going to jab yourself. So you're going to kind of want to grip it like this and then do the pushing. You had mentioned also going to the emergency room or calling 911 to go by ambulance. And why is it necessary to do that if you've given this treatment already?
So while epinephrine is very effective at reversing the severe signs and symptoms of an allergic reaction, we can't predict how things will continue to progress, even if they're starting to improve. So we will recommend getting evaluated by a medical professional.
Okay, good. And sometimes once the epinephrine does wear off, they could actually have
Yeah.
their symptoms show back up again. You talked about blood tests and skin tests not necessarily being fully, perfect in diagnosing, but is one type better than the other if you're trying to decide which one to get first?
Mhm. So they both have pros and cons, and that's what I usually focus on when discussing. So skin testing has been kind of the gold standard in the past because you come into the allergist, you can get it done right away, and you have an answer. It has a very high, it's very good at ruling out an allergy if it's negative, although not so great if the skin test is positive. And so blood testing, on the other hand, is also easy to obtain. You don't need to go to the allergist, although it does involve a poke and a needle stick. And it can sometimes be even more costly depending on your insurance. So it's just balancing those. In the past, the blood test was deemed much more inferior, but they're actually a lot closer in the quality now than they have been. So,
Okay, good to know because sometimes it might be easier to get that blood test done at your
mhm.
pediatrician's office versus trying to get an appointment with an allergist if they're harder to find in your area.
Of
Um,
course. Yeah.
Our next question is, you had talked about that some of these treatments don't cure allergies, but is it possible that a child could outgrow an allergy, for example, egg or dairy allergies?
Yeah. So unfortunately, these medications like omalizumab and Xolair or immunotherapy have not been proven to, help things resolve and grow out of the allergy. What is good to know though is that there are many foods that you naturally grow out of. So milk and egg and wheat, for example, you usually have grown out of these by school age, so age 5 or 6, at least a high proportion. Unfortunately, some of the other allergens like peanuts or tree nuts, there's not a high rate of growing out of them, anywhere between 10 to 20%.
Okay, but you're telling me there's a chance.
Yeah.
Excellent. What about foods that have some of these allergenic things baked into it? So baked goods with egg or milk, is that possibly more tolerable to a child with allergies?
Yeah. So, but it's important to note, right? Like milk and egg are very important foods, right, in a young child's diet, and so we are looking for any ways to introduce any of these foods if possible. Vast majority of children with egg or milk allergy can tolerate and successfully ingest the baked form of them. And the thought process behind this is when you cook it with like wheat, or and you make this matrix, you kind of hide the allergenic, parts of the egg allergen and milk allergen, and you make it tolerable. The important part to note, though, is that this should not necessarily be done at home. This should be done after discussion with your pediatrician and likely an allergist, when and where the appropriate place to try the baked product again, because sometimes we have you come in and do it under supervision of a doctor.
Okay, good information. The next question has to be is deals with, when you see packaged foods with ingredients and it'll say packaged or prepared in a facility that also deals with tree nuts or something, and your child has a peanut allergy. How careful do parents need to be when they see something about that same facility or similar
Mhm.
foods?
So there are a couple laws that were passed most recently, the FASTER Act, that mandates that the top 9 allergens have to be listed as contained. There's nothing that states what you have to say may contain processed in the facility, and there's, what exactly it has to mean. So I often talk and discuss and say that a processed in the facility could mean that the food is on directly next, like a peanuts directly next to this other packaged product, or it could be in a different building. You don't know. And then there's other companies that may not list anything, and the vice versa may happen. They might actually be all mixed together in their processing plant. The general recommendation is to be cautious with this and to avoid it. But if you're generally tolerating that food already, I will, as an allergist, this is my own personal stuff, I'll let you continue it in the diet.
Okay, so if they've tolerated in the past, it's probably good. Okay, my next question has to do, you said there's a nasal preparation of epinephrine now for, yeah, I think you said 33 pounds and higher, maybe 4 years old and up.
Mhm.
Um, how does that work? Is it as fast as the injection straight into the body? Okay, like that's is good for anybody who's needle phobic like me.
Yes, no, it's great. Like, so they've been looking for ways, right, to like decrease the barrier of needle phobia and also increase the administration of the medication. So, for example, when you give epinephrine in your thigh, it causes constriction and tightening of your blood vessels, right? So the medication absorbs, but sometimes it takes a couple minutes. This nasal spray, it works right away. So you have lots of, blood vessels in your nose and stuff. And there's been a lot of great evidence that it just absorbs right away and it starts working immediately. So
Good to know. So I'm glad they finally came up with that, and hopefully it'll be for younger children even as well,
yeah.
because they tend to be a moving target if you're trying to give the epinephrine injection. Okay. I think those are all the questions that have been submitted. Is there anything else that you would like to add that we have not covered yet?
Uh, No, I think I mentioned that I always focus on early introduction, right? Going nice and slow, introducing the foods and having a nice broad diet for your child. And that while food allergies can be severe and impact the quality of life, working with your pediatrician allergist can ensure that your child's safe and eating healthy.
Excellent advice. Thank you so much for joining us today, and I'm going to turn things back over to the AAP.
Thank you.
Wonderful. Thank you so much, Dr. Shu and Dr. DiGiacomo. Great information. We'd like to remind parents and participants to register on healthychildren.org for our e-newsletter, personalized messages, personalized homepage, and special offers. And don't forget to follow healthychildren.org on Instagram, Facebook, Threads, and Pinterest. Also, you can subscribe to our Healthy Children podcast. Listen to it wherever you get your podcasts, or go to healthychildren.org/podcast. We hope you enjoyed today's webinar. You'll be receiving a short survey from us soon. Please let us know what you found helpful and what suggestions you may have. Thanks again for joining us.